Hi everyone, this is Harshita. Welcome to TeddyGuys channel. So today in this video we are going to discuss a very important chapter of lung, that is sarcoidosis. So let's start the class. Sarcoidosis is mostly seen in the western countries and the diagnosis is also exclusion. Okay, it majorly occurs in females. Mostly females are prone to the sarcoidosis and it occurs in the persons having 30 to 40 years of age. Okay, and the clinical features are multi-system disorders, means there are many systems that are getting affected in the sarcoidosis. For example, let's start from the eye. In eye we can see uveitis. This sarcoidosis is a multi-system disorder, means for example a patient came to you with the clinical features of uveitis, sickle syndrome and keratitis. These are the diseases that we get in a person if he is affected with the sarcoidosis. Next one, we can also see salivary gland enlargement. There will be involvement of the salivary glands. They may be sublingual, submandibular or others, and the patient will come with a high temperature, means he will present with fever. There will be involvement of the skin. Hilar lymph nodes can also get enlarged. The patient may get weight loss. There may be genital involvement and bone marrow involvement. Okay, but the most important thing that one should remember is the most affected organ in sarcoidosis is lung. Okay, majorly if a patient come to you with these clinical features, make sure that you keep sarcoidosis as your differential diagnosis. Okay, next let's move to the pathogenesis. In pathogenesis, the most three important points that one should remember is it is type 4 hypersensitivity reactions, means there is cell mediated immunity is seen or is get affected. And next one is there will be increase in the CD4 and helper T cells involvement, and there will be granuloma formation also. Granuloma formation we can see in the tuberculosis and this sarcoidosis. Okay, and here HLA-A1 and HLA-B8 association can be seen. Okay, in this pathogenesis you have to remember 3 points. First one is it is type 4 hypersensitivity. Second one is CD4 and Th1 cells will increases, and the third one is HLA-A1 and HLA-B8 association can be seen. Okay, next let's go into the inclusion bodies. There are 2 points that we should remember is in sarcoidosis we can observe asteroid bodies. This is the most important. As star shaped bodies we can see, and next one is basophilic Chowman bodies. Basophilic Chowman bodies. What are these Chowman bodies? These are nothing but the calcium granules, or there will be more concentration of calcium which is basic in nature. Okay, C for calcium, bodies B for basic in nature. So these are Chowman bodies. Next one is biopsy. If you take the biopsy, we have already learned that granuloma is seen. What kind of granuloma is seen? The granuloma we can see is naked. Okay, let me zoom this. The granuloma we can observe is naked granuloma can be seen. Okay, naked granuloma can be seen. Why it is naked? Because there are absent of lymphocytic collar. Lymphocytes are absent here, so the granuloma is naked in the sarcoidosis, whereas in TB they are presence of giant cells, so it is not naked. Okay, and the second one, let's see what type of granuloma. The epithelioid cells, these are the epithelioid cells which are slipper in shape. These are slipper in shape, and at the center we get the non-caseous granuloma. In TB we get the caseous granuloma or caseous necrosis. Sarcoidosis you can observe the non-caseous granuloma. Okay, the points that you should remember is it is naked. Why it is naked? Due to absence of lymphocytic collar, and what it is contains, they are containing slipper shaped epithelioid cells and the non-caseous granuloma. Okay, now let's go into the biochemical test. In biochemical test, we already discussed that there will be increase in the CD4 cells and CD8 cells ratio. The ratio will get increased because CD4 cells are getting increased. Okay, numerator is getting increased, hence the overall ratio will get increased. Next one is Kaiman's test is positive. Next one is serum calcium is positive. Why serum calcium is positive means here we can observe Chowman bodies. These Chowman bodies are made up of concentrated calcium. Hence serum calcium concentration increases, and this is metastatic calcification, and there will be angiotensin converting enzyme will get increased in this syndrome. Okay.